Hello and welcome to Medical Dialogues, your daily dose of health and medical news. I'm Mr. Zaman and here's what I bring to you all from the world of medicine. COVID out clinical trial. Published in the New England Journal of Medicine, researchers led by University of Minnesota Medical School and School of Public Health have found that metformin, a commonly prescribed diabetes medication, lowers the odds of emergency department visits, hospitalizations, or death due to COVID-19 by over 40% and over 50% if prescribed early in the onset of symptoms. The study also found no positive effect from treatment with either ivermectin or low-dose fluvoxamine. The study design was simple. Patients were randomly assigned to receive one of the three drugs individually, placebo, or a combination of metformin and fluvoxamine or metformin and ivermectin. Although the study was placebo-controlled with exact matching placebo pills, Dr. Caroline Baramante, the study's lead author, says that 83% of volunteers received medications supported by existing data because of the 6-arm design. Each participant received 2 types of pills to keep their treatment assignment masked for 3 to 14 days of treatment. Each volunteer tracked their symptoms and after 14 days they completed a survey. The clinical trial launched in January 2021 after U of M Medical School researchers identified through computer modeling and observational studies that outpatient metformin use appeared to decrease the likelihood of mortality from or being hospitalized for COVID-19. Identification of genes strongly linked to autism and neurodevelopmental disorders. A new study of genes underlying neurodevelopmental differences has uncovered more than 70 that are very strongly associated with autism and more than 250 with strong links to the condition. The analysis is the largest of its kind to date and includes more than 150,000 participants, 20,000 of whom have been diagnosed with autism. The results offers the most comprehensive look yet at diverse forms of genetic variation in autism and in more broadly defined neurodevelopmental conditions. The insights shed light on the molecular roots of brain development and neurodiversity and provide new avenues for future research on the biology of autism. In an analysis led by co-first author Minxi Peng, the scientists examined the expression or activity levels of the genes they uncovered in developing human neurons. They learned that genes linked predominantly to developmental delay tend to be active in early neuronal development, whereas autism-related genes tend to play a role in more mature neurons. Furthermore, in an analysis of more than 20,000 samples from individuals with schizophrenia, the researchers found that genes that are strongly associated with autism were also more likely to be associated with genes that increase risk for schizophrenia. Based on the study findings, co-senior author Joseph D. Buxbaum said a precision medicine approach to autism would benefit patients as treatments that work for individuals carrying a mutation in one gene may not work in other individuals carrying a mutation in a different gene. Successfully engineered immune cell model which paves way for new treatments targeting common infection among immunocompromised children. The research led by Murdoch Children's Research Institute and published in Stem Cell Reports journal used cutting-edge stem cell technology to better understand how the infection invades immune cells and causes health complications such as lung and skin and soft tissue infections in immunocompromised people, particularly those with cystic fibrosis. Researcher Dr. Shicheng Jackie Sun said the immune cell type the team created in the lab, known as a macrophage, played an important role in infection, inflammation, and regeneration, but due to this function was also a natural host for germs. Dr. Sohini Sarkar said due to high treatment failure rates, repeated cycles of infection could greatly damage the lung tissue and accelerate progression of lung failure in those with cystic fibrosis. Improved treatments could mean less frequent hospital visits, shorter stays, and minimal exposure to toxic antibiotics, which is particularly important for children with cystic fibrosis, she said. Data shows 11% of children with cystic fibrosis test positive for mycobacteria. Dr. Sarkar said the infection model could also be used for drug screening for other superbugs with limited treatment options. Routine depression screening, which may capture underdiagnosed patient populations. Implementation leads to better symptom recognition in older adults, minorities, men, non-English speakers, UCSF-led study shows. Screening for depression at the primary care level could dramatically increase the likelihood of treatments for those who are traditionally undertreated. Racial and ethnic minority individuals, older adults, those with limited English proficiency, and men, according to a new study led by UC San Francisco. The researchers tracked electronic health data of 52,944 adult patients seen at 6 UCSF primary care facilities over a 2-year period. After a routine screening policy was implemented, depression screening rates more than doubled from 40.5% in 2017 to 88.8% in 2019. The researchers reported in their study, which was published in JAMA Network Open. In 2018, they found that for every 100 patients aged 18 to 30 screened for depression, 75 patients aged 75 and older were likely to be screened for depression. For every 100 patients screened for depression, there were 59 Chinese language patients and 55 other non-English language patients likely to be screened for depression. By 2019, statistically significant disparities virtually disappeared for older patients, Black or African Americans, other English-speaking patients, and patients with language barriers. However, screening for men remained relatively low. For every 100 women screened for depression, 87 men were likely to be screened for depression compared to 82 men before the policy was implemented. Our study shows that a systems-based approach can increase depression screening and address screening disparities, said senior author Leah S. Carliner, MD professor in the UCSF Division of General Internal Medicine. Depression screening is necessary but not sufficient to decrease care disparities. Screening may help with poor physician recognition of depressive symptoms, but it must be followed by clinical action, said first author Maria E. Garcia. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.